Cancer, understanding symptoms and causes. Cancer is a complex group of diseases characterized by the uncontrolled growth and division of abnormal cells within the body. It is a leading cause of death worldwide, and its impact on individuals, families, and societies is significant. Understanding the symptoms and causes of cancer is crucial for early detection, effective treatment, and prevention efforts. This article delves into the diverse aspects of cancer, shedding light on its symptoms and underlying causes. Symptoms of cancer. The symptoms of cancer can vary widely depending on the type, stage, and location of the disease. It's important to note that many of these symptoms can also be caused by conditions other than cancer. However, persistent or unusual symptoms should be discussed with a healthcare professional for proper evaluation. Some common symptoms of cancer include unexplained weight loss. Sudden and unexplained weight loss can be a warning sign of several types of cancer. This may be due to changes in metabolism caused by the presence of cancerous cells. Fatigue. Extreme and persistent fatigue that doesn't improve with rest is another common symptom. Cancer-related fatigue can result from the body's immune response to cancer or the cancer itself depleting the body's energy resources. Pain. Chronic or localized pain can be an indicator of cancer, especially if it persists over time and doesn't respond to typical treatments. Changes in skin. Skin changes, such as the appearance of new moles, changes in color, or excessive itching, can be signs of skin cancer. Persistent cough or hoarseness. A persistent cough, hoarseness, or difficulty swallowing could point to cancers of the lung, throat, or esophagus. Changes in bowel or bladder habits. Changes in bowel or bladder habits, such as blood in the stool, prolonged diarrhea, or frequent urination, could indicate colorectal or bladder cancer. Lumps and bumps. New or growing lumps, particularly in the breast, testicles, or lymph nodes, could be indicative of cancerous growths. Indigestion or trouble eating. Persistent indigestion, difficulty swallowing, or other digestive issues might be linked to gastrointestinal cancers. Unexplained bleeding. Unexplained bleeding, such as blood in the urine, coughing up blood, or between-period bleeding, can be a symptom of various cancers. Causes of cancer. Cancer is a multifaceted disease with numerous factors contributing to its development. While the exact causes can vary based on the type of cancer, there are some common risk factors and mechanisms associated with its occurrence. Genetics. Inherited genetic mutations can predispose individuals to certain types of cancer. For instance, mutations in the BRCA genes increase the risk of breast and ovarian cancers. Environmental factors. Exposure to carcinogens in the environment, such as tobacco smoke, asbestos, radiation, and certain chemicals, can significantly increase the risk of developing cancer. Lifestyle choices. Unhealthy lifestyle habits, such as smoking, excessive alcohol consumption, poor diet, and lack of physical activity, contribute to the development of various cancers. Viral infections. Certain viruses, like human papillomavirus, HPV, hepatitis B and C viruses, and human immunodeficiency virus, HIV, are linked to specific types of cancer. For instance, HPV is associated with cervical, anal, and throat cancers. Chronic inflammation. Prolonged inflammation caused by conditions like inflammatory bowel disease or chronic infections can create an environment conducive to cancer development. Hormones. Hormones play a role in the growth of some cancers. For example, estrogen exposure is linked to an increased risk of breast and uterine cancers. Age. Advancing age is a significant risk factor for cancer. As cells accumulate genetic mutations over time, the likelihood of abnormal cell growth increases. Immune system dysfunction. A weakened immune system, whether due to immunosuppressive medications or certain medical conditions, can fail to recognize and eliminate cancerous cells. Hereditary factors. While most cancers are not directly inherited, some genetic predispositions can increase the likelihood of cancer within families. Conclusion. Cancer remains a formidable challenge in the field of medicine, but advancements in research, detection, and treatment are constantly being made. Recognizing the symptoms and understanding the underlying causes of cancer are vital steps in promoting early diagnosis and effective interventions. By addressing modifiable risk factors like unhealthy lifestyle choices and exposure to carcinogens, individuals can take proactive measures to reduce their cancer risk. Furthermore, ongoing efforts in education, research, and public health initiatives continue to contribute to the prevention and management of cancer on a global scale.